Alright, welcome back everybody for this week's training. My name is Ben. As you all know, it was very nice meeting some of you and talking with you. This week we're going to be covering the bloodborne pathogens and stop the bleed. As you all know, because you've been through the training before, it's mandatory for every year. It's a yearly requirement, and it's required by OSHA as well. So for the training objectives for this week, we're going to be dealing with the bloodborne diseases, the spread of them, what we might have to do that might involve exposure, ways to reduce the chance, the procedures to follow after, and the Hep B vaccine. As far as the control plan, the plan is to eliminate or minimize the employee occupational exposure through contact through blood or bodily fluids. As far as exposure, the potential risk in just dealing with it as far as if it's splashback or dealing with anything with blood in it. So for us, category 1 is first responder, so firefighters, EMS, or police. What are they? They are bacteria or viruses which are carried in the blood or bodily fluids that carry diseases. The ones that are of greatest concern are HIV, Hep C, or Hep B. Excuse me. They can be spread through contact with the infected through blood. That is the number one source. And bodily fluids that contain blood. They cannot be spread through casual contact, coughing or sneezing, hugging or drinking from the water fountain. And they are not spread through the following: tears, saliva, sweat, or urine, etc. How they are commonly spread is sexual contact from mothers to infants, accidental puncture wounds, or contact between any of it, whether it be broken skin or eyes, nose, and mouth. They most likely occur with accidental puncture wounds with a contaminated object or infected body fluids, such as the skin. Universal precautions. The effective way of preventing them is to treat all blood or bodily fluid as if it's contaminated. Use gloves, always use gloves, hand washing or hand sanitizer, and then after everybody, when you're disinfecting the surfaces, use bleach or So the next one we're covering, it's hand washing. As it says on the slide, most important method for reducing exposure. Use soap and water. And as everybody knows, when you wash with soap and water, as everybody likes to, when you're washing your hands, sing your ABCs. Turn the water on, get your hands wet, get some soap, and do the ABCs. Now, as far as work areas, do not store your food or drink in the fridge where potential blood or bodily fluids that might be infected are stored. Now, what is PPE? Most commonly used one is gloves. But as PPE is, it's the barrier that people use between you and yourself for potential bloodborne pathogens. You can get them from your supervisor, and we'll be covering it later, how to remove your gloves, and also how to dispose of them. As we just covered, they are the most covered. The gloves are the most common form of PPE. They should be worn at all times, and when taking gloves off, do not touch your skin, or avoid touching the skin to your bare skin. The next part of the PPE is the disposable goggles, masks, or aprons or gowns. They should be worn at any time that there is a risk of spraying, spattering, splashing of any blood or bodily fluids. Does anybody know why that is? Or why we should also, when dealing with CPR, why we use one of them?
I have a question about goggles and masks.
Okay.
And I don't know how this has come up. I guess it's because people maybe are uncomfortable with the goggles. That if you put on a mask, is it not always necessary to put on the goggles?
Excellent question. Actually, it's very recommended that you do because, yes, you are wearing a mask. You're covering your nose and your mouth, right? Where else can blood get on your face? Into
That
your
was my
eyes.
thinking. If something splashes, it could get in your eyes as well as get on your nose. I mean, okay,
But
so
your eyes
so
are
I
the
would
next
think it's
place.
just
If it lands on the mask, where is it? I mean, you're dealing with splashback.
yeah. So my thinking is, if you need a mask, you need goggles.
Exactly.
Okay.
All right, so for decontamination, all surfaces need to be cleaned and scrubbed and decontaminated as soon as possible. And the approved disinfectant is 1 to 10 bleached water. So for a big bucket of water, you probably need about a capful. And also, a new set of PPE should be worn. Now, as far as disposal, as you've seen at your doctor's office, I'm assuming, you've seen the needle box, but also dealing with bags or dealing with anything with blood on it that's saturated, you put it in a biohaz bag.
But now, if it's not, go back. If it's not saturated, you can just put it in the regular trash. Which means if you thought there might
If
be
it's
some
not
blood
saturated or
there,
caked, yeah. Like if you're dealing with somebody that has a wound or like,
but you really
say you
don't
take
see
your
a lot of
jacket
blood
off.
on it.
Say you take your jacket off, and and you use it to help stop the bleed. It's caked with blood now. That needs to go in a biohazard.
Okay.
But if you just barely got it on it, regular trash.
Okay.
So regulated waste.
This is where you got the biohazard stuff. Okay.
Yep. So everybody knows everybody's seen a biohazard. This is just a small form of the biohaz bag that you normally see in a trash can compared to the one up there. And then everybody, if they've gone to their doctor's office, has seen the needle waste. They're weirdly shaped, and as soon as the needle gets put in, they actually make a weird noise. As far as preventing, always use universal precautions when dealing with blood or bodily fluids, and always use PPE. Steps to take after a possible exposure. Wash the area, whether it be your eyes, nose, mouth. Nobody wants to stick a bar of soap in their mouth or stick soap in their mouth. But, if you got it in your mouth, that's necessary. Flush it. Flush it. And wash everything for at least 15 minutes. Fill out the exposure control paperwork and the workers' comp paperwork as well after talking to your supervisor, and then go to the designated clinic. Everybody by now should have the Hep B vaccine. There's 3 doses, and it's almost 95% effective against preventing the exposure, and they're free. And the points to remember for this, BBP, bloodborne pathogens, are carried in blood and bodily fluids. But what is the number one source?
Blood.
Exactly. And universal precautions treat all blood and bodily fluids if they are infected. Use PPE if there is a risk. Decontaminate the areas of possible BBP exposure promptly and appropriately. And if you are involved with possible exposure, wash the area immediately with soap and water as soon as possible, and speak with your supervisor. And another main point to remember is most exposures do not result in infection. Alright, now it's time for the test. I'm handing out to each of you. It's only 5 questions. We're going to grade it real quick. And I'll let you know your grade immediately. And you also have to make sure you have 100 on it. And you will have your certification later today. Alright, you ready? Miss Diane. So first question, what can you do to help prevent getting a bloodborne pathogen?
Hand washing?
And
I can't remember, but I know I got it right.
what do you need?
Wearing gloves, yes.
There you go. So you got your points on that one. Okay, so name 3 types of bloodborne pathogens transmitted.
HIV, Hep C, and Hep B.
Perfect. Always wear gloves when you anticipate touching blood, ugh. Sometimes I hate speaking. Body fluids or contaminated surfaces.
True.
Perfect. If you are involved in a possible exposure, wash the area immediately. Report the incident to your supervisor as soon as possible.
True.
HIV poses a greater risk to personnel than Hep C and Hep B.
I said no, that's false.
That
I was
is
a little
false.
shaky on that one because I think because I've had the Hep B that Hep B is you're more
No,
out
that is
Hep B.
false. So you got your 100.
There you go.
All right, time for the glove skill. Let's take a look at this. You gotta love technology.
We're calling these the new billion-dollar solar panels. They're a new generation of super powerful solar panels that was just released on...
Today we're going to demonstrate how to properly put on and take off latex gloves. Doing this correctly is essential for effective protection. Before we start, remember latex gloves are intended for single use only. First thing, examine the gloves before putting them on to be sure there are no holes or cuts in them. A best practice, don't wear gloves over jewelry with sharp edges that could cut or puncture the gloves. Most gloves are pretty durable, but put them on carefully to ensure they don't tear. This is important. When removing the gloves, carefully remove them by the cuff rather than the fingers, and turn them inside out as you remove them. Remember, don't touch the outside of the gloves with your fingers when removing. Dispose of them in the garbage. However, if the gloves are contaminated with blood, they'll need to be disposed of properly in a biohazard bay. Wash hands thoroughly afterwards. Take a look at our hand washing video for more information. Thank you and stay safe and healthy out there.
So, we're checking to make sure we don't have any punctures. Nope, everything's good. Alright, so you squeeze at the palm, you pull it down, and you put it in the other palm. Next, you take your other 2 fingers, sound good?
The important thing is just never touch the outside, right?
Exactly. You want to come up and
Okay.
share the class?
Okay. Well, we use some fake blood. I see that. Okay.
Alright, well, I have my...
Wait a minute, I got to pick out the right size glove here. Okay. These.
Well, luckily luckily I made my own fake blood.
I want to wash my hands. I'm good. I want to wash my hands before I put these on, and I'll wash my hands when I take them off. Let me get them all correct here. Okay, hold on. Okay.
Gotta zoom in. Alright, so you can see how the blood gets everywhere on the gloves. That's how the blood works.
Okay.
So you need to be able to take the gloves off properly.
Well, I'm just gonna make sure that I just don't take this off without getting this on. Okay, hold on.
There you go. So you got one.
Let's do this. Okay, well, it flipped it and I got it on the outside, but so far so good.
Now where do they go?
Now, I would put them in the biohazard bag, but I'm gonna be,
Right here.
there you go.
Perfect.
And I'll wash my hands.
Alright. So we're doing good. Alright, welcome back everyone from the break. I hope you enjoyed your lunches. It is very nice talking to each and every one of you again. Again, my name is Ben Wall. We're covering the class as far as stop the bleed and bloodborne pathogens today. Now, what to do and how to do it. As you can see, I've got everything set up here. We've got our tourniquet. Obviously, we're not going to have a victim up here, so I've used a pool noodle of how to pack the wound. Now, as far as everything in this facility, we've got our bleeding control. We've also got our bloodborne pathogen kit. Now, how to do it. We've got 2 videos to watch right here real quick. Give me just 1 second here.
People always ask us, in the event of a mass casualty incident, what could they do? What could they do differently? Today I'm going to talk about the few little things that people can do to save a life. In the event that somebody is bleeding in a place where you can act to save their life, the first thing you can do is take a jacket, take something soft, and you're going to apply it to where they're bleeding. If it's their arms, legs, or where they attach, you're going to just simply place it on the area that's bleeding and push really hard and hold it.
Keep the
until
pressure.
help comes or the bleeding stops. If help doesn't come right away and you need to sustain this and you're tired, you can either secure it with an ACE wrap or a belt or anything that's going to hold that pressure in place. At the very least, switch out with somebody else who can maintain the pressure until help arrives. The hemorrhage control kit is very, very simple. The ones that we have here at BUMC say traumatic bleeding, and on the other side have the instructions. So even in a bad situation, when people are panicked, they can see the pictures and know what to do. It's very simple. Within this kit are all the tools that you need to make this happen. So if you've got somebody who is bleeding from a bad wound, and we're going to say, for instance, this is on their leg, and I have access to this kit, and somebody has been holding pressure, someone brings the kit, and now I need to move to a tourniquet in order to stop the bleeding, I have the ability to take this tourniquet, open it up, place it above the wound, turn. And people ask, how many times do you turn? You turn until the bleeding stops, and you'll see that it's actually a very physical thing. Secure it and over. If you're lucky enough to have a pen, you can write the time here, but I don't really care where you put it. Just make note of the time. It helps with decision making when the patient is taken to the emergency department to get further care. If you have something that is within a shoulder or you're unable to put a tourniquet on, the reason why we have gauze and this combat gauze is what they call it, or quick clot, is that then you can pack the wound and stop the bleeding by constricting the vessels on the inside. Well, that sounds kind of complicated, but basically all you're doing is putting pressure on the inside instead of pressure on the outside. And again, what you do is you open up this package and you would pack the wound. Until you cannot do it anymore. And at that point, you're going to hold pressure. And again, you're going to hold pressure for at least 2 to 4 minutes, if not longer, sometimes up to 10 minutes, or until help arrives. What you've done is you've given that person every opportunity to survive in a bad situation. This is just a few steps that you can do. It doesn't guarantee that there will be a bad outcome or a good outcome. It just means that there's something that you can do to help in a time of need.
All right, any questions about the first video?
I noticed that she did not have on any gloves or talk about the person wearing gloves. So when we do our little check off, do we need to wear gloves?
Absolutely. Now, to address that situation, in all situations, yes, it is always necessary to wear your PPE, whether it's the gown or the gloves or the mask or the gloves. Gloves are almost always necessary, but sometimes you don't have access to them.
An emergency.
Exactly.
Well, I remember from the last class, most incidents don't cause, most exposures, that's the word they use, don't cause an infection. So I
Exactly.
guess, yeah, like I don't have any breaks in the skin on my hands, so I'll probably be all right.
Well, like we were covering earlier in the bloodborne pathogens, most exposures, they don't happen.
Yeah.
However, if you're worried about it, go see your doctor.
Okay, I'm sorry I interrupted you. You were going to the second video. Sorry.
There we go. And now the second video. Alright, this one's a little bit longer.
Need a private, secure, easy-to-use telemedicine solution. Video's proven telehealth platform.
There you go.
Hi, I'm Gina Solomon. I am the trauma program manager here at Gwinnett Medical Center. Uncontrolled life-threatening hemorrhage is one of the leading causes of preventable death after traumatic injury. Gwinnett Medical Center is partnering with the National Stop the Bleed campaign to provide training to bystanders on how to control this life-threatening hemorrhage. Everyone should know how to identify life-threatening bleeding and know how to take the appropriate steps to control the bleeding until help arrives. There are a couple of primary principles to controlling life-threatening hemorrhage. First off is to ensure your own safety. It's very important that you make sure you are safe before you render aid to anyone else. The second principle is what we call the ABCs of bleeding control. A, alert, you want to call 911. B, bleeding, be able to identify the life-threatening bleeding. And C, compress. And there's 3 ways that you can compress the bleeding, and we're going to go into detail about each one of those. The first principle of the ABC is A, alert, call 911. It is really important that you get the pre-hospital providers en route to take over care while you render aid. B is bleeding. being able to identify what is life-threatening bleeding. If you see bleeding spurting from a wound, pouring from a wound, clothes that are soaked in blood, you have bandages that are soaked in blood. If the person is missing all or part of a limb, an arm or a leg, or the person is becoming dizzy or unconscious, those are all signs of life-threatening bleeding. Wounds that can lead to death from bleeding are often located in the arms and legs, torso-junctional, which is the armpits, the groin, or the neck, or the chest and the abdomen, or internal bleeding. Unfortunately, with internal bleeding, bystanders cannot really impact those injuries, and they need quick access to a trauma center. And then C, compress. There are 3 ways to compress. First is just holding pressure. It is really important that if you have access to gloves, you want to put those on before you render any
Does that
care.
answer your
To
question?
protect yourself from bloodborne pathogens, this is an important safety step. So you want to put your gloves on,
Did you notice what she did wrong there?
and then if you have access to gauze, that is
From
great.
the previous video.
But if you do not, any clean cloth will work.
What does she
If
have
you
on her
a
fingers?
towel, a
Jewelry.
t-shirt,
Yeah.
whatever you may have handy will work just as well. You want to take the gauze or the clean cloth and fold it and place it directly over the wound. You want to put the heel of one hand on the cloth, the heel of your other hand on top of your first hand,
So the
and
hem
lean
of it
in
is almost
and
like
put as much
CPR, like we
pressure on
covered
the
the other
wound
week.
as you can. You
Keep-
want to stay
keep
this
the
way
pressure on.
until help arrives. Do not peek, you don't want to look, you just want to hold pressure until the pre-hospital personnel can arrive and take over.
Does anybody know why that is? Why you might keep the pressure, or peaking, or why would that be? No? Here's why. You do not want to take your shirt or your jacket or the gauze pads off of, let's say this is the wound. You're keeping the pressure here. What does blood do when you get a scab or it's the clotting process? Why do you not want to peek at it? No? When you're dealing with the clotting process, you keep the pressure because you're helping, you're preventing from blood getting out of the body, A. But as far as the clotting process, if you take it off, whether it be gauze or a jacket or a shirt, when you take that off, you're hindering the clotting process. So it's not going to scab over, like a scab on your knee or a scab on your arm. Does that make sense?
Or you're going to disturb the clot. You're going to tear it off.
Well,
Yeah.
You're
okay.
hindering.
Okay.
You're hindering the clotting process
Okay.
when you take a peek at it. So, gauze pads. You're holding it tight.
So the answer is, if that gets saturated, you just pile
Keep
them up.
keep adding more.
Keep piling them up.
You do not, just like she said, you don't take a peek to see how
Yeah.
it's doing.
Just pile them
Even
up.
if it's saturated,
Put another one on top of it. Okay.
keep adding more until emergency personnel
Help
arrive.
arrives, okay. I appreciated that she said the call for help, because we missed that in the other.
Air. The second principle of compress is tourniquets. Tourniquets are used when you have life-threatening bleeding to an arm or a leg. If you have access to a bleeding control kit, they will have tourniquets in them. This is what's known as a cat tourniquet and is the most common tourniquet that is placed in those kits. It is a Velcro band, so you just want to unfold the band
And that's what will be.
and take the circle and place it on the limb, over the site of the bleeding. It's really important that you go above the wound, and you also want to go above a knee or an elbow. It is okay to put it on top of clothing, just make sure there's nothing bulky in a pocket like keys or such that would impact the tension that we're going to place on the tourniquet. You want to take the Velcro strap and tighten it down on the limb. It just has to be snug. You are then going to notice there is a rod that is attached to the tourniquet. Once you have the Velcro strap snug on the limb, you want to turn the rod as tight as you can. You're going to twist until you cannot twist anymore, and it is very tight. Once you can no longer tighten the rod, you're going to place it in the C-clip to hold the rod in place. You then can take what's left of the strap and place it on top of the rod through the strap. Many of the tourniquets will have another Velcro strap that you can place over the C-clamp. Tourniquets are very painful, and it's okay to tell the injured person that this is going to hurt. You do not want to loosen it. You want to leave it as is until the pre-hospital providers take over care. They can give the person pain medicine to help with the pain, but it is normal for them to feel significant pain after the tourniquet has been placed. The third principle to compress is wound packing. Again, if you have access to gauze, that is great, but if you do not, any clean cloth t-shirt can be used as well. What we're going to do here is actually insert the gauze or the clean cloth into the wound to stop bleeding. So you want to take the end of the gauze or cloth and actually pack the wound. You want to use your fingers to place the gauze tightly and as deeply into the wound as you possibly can. And you're going to continue to pack until you cannot get any more gauze or cloth into the wound. Once you have packed it as tightly as you can, you then want to compress with pressure. So you want to put what's left of your gauze or t-shirt on top of the wound, apply the heel of your hand, the heel of your other hand on top of that, and lean and apply direct pressure. Again, you do not want to let off of the pressure until the pre-hospital personnel arrive to take over care. Bystanders can make a huge impact with life-threatening bleeding until first responders can arrive. The only thing more tragic than a death is a death that can be prevented. Thank you.
All right. Any questions so far?
So what are we gonna, we're gonna demonstrate applying pressure,
All right.
packing the wound,
Yep.
and doing the tourniquet.
No, but do you know how to put your hands?
Yeah, like CPR.
So do it on the arm. Hard. Down
Okay.
hard. You need to
Okay.
keep that pressure. You need to keep
Okay.
that blood in.
Okay.
All right. So you remember how to pack the wound?
I want to start with the tourniquet because I want to see it.
All right. So mine's a little bit different than hers that was up there. And I don't tuck mine. I'll leave that out.
Yeah.
Take that off, all the way off.
Okay, let me get it.
Other way. All right. So say I'm bleeding out.
No, I want to put it on you. Here you go.
So the wound's down below the elbow.
Yes, we got to be above
Above the wound.
Yeah, hold on.
Also, what else do you want to do?
Hold on.
There's one other thing you can do also with the tourniquet on there. Wounds, whether on the extremities, whether your arms or your legs. What else do you want to do when it comes to the patient? Stop the blood flow.
Oh, yeah, you could elevate it, but I'll get this on first. Let's see.
Don't worry about the time. You've got tight enough. You want
Am I
snug.
ready? Now, the first video they talked about stopping the bleeding, which of course we can't see, but this is
You almost
as
got it.
tight as those will go. Hold on.
And then tuck it under. All right. Now, this came out of my kit, so you don't have to worry about that's why they have the time tag.
Okay, so you write the time. Well, let's don't write
When you
the
put
time.
the tourniquet on.
Okay, but what I've gotten is we're not really concerned about the time because we're going to leave it on till they get to help regardless.
But they need the time.
It would help to have it on, yes, but she said no matter. There's no,
Exactly.
you got too much time. Like you can't have 4 minutes is too long. and we're gonna tell the patient, this may hurt, but we can't loosen it or take it off, because goodness, if we took it off,
If we had a gash, they'd be spouting out blood.
we've
So
done
yeah,
away with all the good we did.
pretend I'm the victim,
Okay.
and you've put this on me. I'm sitting here yelling out in pain.
Uh-huh.
How would you talk to me as the
Uh-huh.
victim?
I would say we're gonna give you some pain medication.
So you would, no. EMS hasn't arrived.
Okay.
I'm just the victim.
Okay. Then EMS
So-
will give you some when they get here, but we just
But-
can't leave this on.
And it's gonna hurt.
Yes, it's gonna hurt. Okay.
Alright.
Okay, so tourniquet, this is interesting, and you call this a C tourniquet, because this is a C. Okay.
Yep.
Alright, so,
Alright. So now we're packing the wound.
I have a jacket, and I could use this for pressure, but I'm not, because you got everything here. I put on the tourniquet, I didn't have gloves, but I'm gonna put on gloves to do this. And I see you've got gauze. And I see we've already got gauze pads.
Yep.
Okay. And if I didn't have gloves on,
Well, I
But now
mean, in
this
every
is a
emergency
deep-
situation,
this is a
you
deep-
can't, you don't always
This is a
have,
deep wound here.
in every emergency situation, you don't have access to gloves.
Yeah, okay. Let's see this.
Find the end.
Okay,
There you go.
so.
There you go. Now, you've got your leftover. What do you do with the leftover?
Well, I think I can still get some in here.
Alright.
Alright.
I wouldn't pack it in, I would
Yeah.
leave just a little bit of the tail, just to, in case the
Alright, now
medic
we'll
gets
put
out.
this on here.
And keep it, how did she say apply the pressure?
Okay.
Almost like you're doing CPR and doing compressions. Interlock your fingers, perfect.
Okay,
Now that is awesome, that's perfect pressure.
okay, so this is it.
That's
Is this
better.
all wrong? Okay.
Now, have you been able to find one of these in your workplace?
It was over where the AED was. And
And
after
what
the last
about the
patient, and
pathogen?
it's in the same area, not in the same spot, but this was above the AED.
Perfect.
So here we got the bleeding stuff, and it is
Should be packed with several of these.
several of the individual kits. So if there were numerous of us, we could grab them and open them up.
So unlike mine, which was the military style, which is black,
Okay.
there should be several of the tourniquets just like this, but bright orange.
Yes. Well, you've got one in
And-
there.
Packing gauze
Okay.
and trauma dressing.
Yes. And yours must just sell like combat
Oh,
dogs or
it-
something, combat stuff.
There,
Okay.
sometimes the combat ones are a little bit more.
Okay. All right.
All right.
Okay.
So,
Excellent. Put these gloves over. All right. Ooh.
all right.
Ooh.
So what's next? Have a seat, Miss Diane. So here's what's coming up next. So there's a van parked out front that is from Stop the Bleed. Big one, can't miss it. So there's 6 stations. 2 on the head, 2 on the torso and arms, and then 2 on the lower extremities, so the groin and lower. This victim is one that came out of a, I forgot the word. I just had a brain fart. Gotta love that. I really just had a brain fart. Where they play football at?
A stadium.
Stadium.
Football stadium.
Yeah.
Bank of America.
Thank
Stadium.
you. Yes, stadium. This is a stadium explosion victim. So he's been hit in the head. And his leg is blown off. So we've got 6 stations total. And we're going to take a look at that. Or y'all will. So the next part will be a little bit more engaging, and I hope y'all will have a little bit more fun with it other than just sitting here in the classroom.
When I came in, I saw the van, and I saw several men out there. They haven't stopped the bleach short, so they're directing us because this looks a little scary.
Yes, ma'am.
Oh, okay.
And that was just a mannequin.
Oh, I know.
The previous one, that's just a mannequin.
Okay.
So they'll direct you around. It'll take another couple hours to go through all 6 stations just to see how to deal with whatever you're dealing with, whether stop the bleed,
We're getting a lot of guidance from them. Okay.
Exactly, but it's a little bit more fun than being stuck in a classroom. All right, and now, if y'all will head out the
we're
door.
all getting a kit.
Absolutely.
And we're all getting certified.
Absolutely.
Okay.
Your certification will come a little bit later. I've already got all y'all's tests
Okay.
that I'm sure all y'all made 100 on.
Okay.
So your certification you can retrieve it from your supervisor later today. Thank you so much for being here. Again, my name is Ben. It was very nice meeting all of you.
Thank you.